we've increased our likes by 50%. And that's credit to people sharing the page, sharing any post I make. So tonight we're going to talk about healthcare. Healthcare in West Virginia. What if you haven't heard, West Virginia has a law called Certificate of Need. If you don't know what this, if you've listened to me speaking at all in the past, you will have heard this speech before. But I've got, I'm gonna regurgitate the history of Certificate of Need, and then I'm going to talk about some things that will move West Virginia forward and save both the taxpayers and individual citizens and families an immense amount of money if we parallel what some other states have done. And really, some of the stuff that I'm going to talk about tonight really needs to be done on a nationwide basis. And one thing that you may or may not have followed is President Trump put out an executive order to require all healthcare providers basically tell you what their costs are for their different procedures, supplies, going in to get a MRI, things like that. And of course, I don't know how far he's going to get with that. The biggest thing you need to know is the fact that the National Hospital Association has already sued to try to stop him from doing that. That tells you that it's probably the right thing to do. So, Certificate of Need. Certificate of Need was a federal mandate. It was a federal law passed in 1974 that required every state to pass a Certificate of Need law to get the federal dollars. Matching dollars, Medicaid, Medicare, things like that. And in 77, West Virginia passed the Certificate of Need law. It is currently, according to most of the stuff I've read, is the sixth most expansive Certificate of Need law in the country, which means it covers more things, MRIs, things like that. It's very expansive. Now, the Certificate of Need law that was passed, the mandate from the federal government was supposed to do three things. It was supposed to increase access in rural areas, supposed to decrease cost, and it was supposed to increase quality. So West Virginia passed theirs in 77. It's the sixth most expansive, according to the reports I've read. Covers the most things. And those three things it was supposed to do by the federal mandate, it did none of those. So by 1986, the federal Congress did something unheard of at the time, which they repealed the Certificate of Need mandate. Basically said that you don't have to have that at the state level, because they determined that it didn't decrease costs, it actually increased costs. It didn't increase rural access, it actually decreased rural access, and it didn't increase quality, it actually reduced quality. So they repealed the federal mandate, I believe in 1986, 1987. Since that time, about 15 or 16 states have totally repealed their Certificate of Need law. Several other states have actually reduced greatly what is subject to the Certificate of Need. As an example, Oklahoma only has basically two things subject to Certificate of Need. They have psychiatric hospitals and nursing homes. That's it. And the Mercatus Center, which is a free market leaning think tank out of George Mason University, has determined that the average cost reduction in those states that have totally repealed the Certificate of Need law, if I recall correctly, is about 5%. So that's one thing that needs to be done in West Virginia. Now, I will tell you that there are very powerful forces that are against repealing the Certificate of Need law, abolishing it. One I will just tell you is associated probably with the National Hospital Association. It's called the these people used to be supporters of mine. West Virginia Hospital Association. You see that? That's the front page of what they call the IRS 990 form. Now, the interesting thing about that is, and I don't do this to really bash anybody, but it's important to note that there is a lot of money in representing nonprofits. I'm going to cover this guy's name up because I really don't think it's important that you know his name, but I think it's important that you know how much he's paid. The head of the Hospital Association there, if you can see these two numbers, $769,283, and his fringe benefits are $210,584. Let that sink in. Almost $1 million to represent the hospitals in the state of West Virginia. And you know, I don't fault anybody for making money, but the left is totally unhinged. The left thinks that it's the free market system that has gotten us to where we are in the healthcare system, and that's a fallacy. So you're going to join me for a minute. All right. Sorry, I have an interrupter. This will make you happy. I got a little guy here. It's finally over being sick. Say hi to everybody. You say hi? You can't? Okay. Why don't you go to mommy so I can finish? So we haven't had a free market healthcare system probably for half a century. Not anywhere close to it. So there are two things that can be done, and there's actually a history of another state doing it that has saved, in the case of their public employees, a huge amount of money. And that is, and I mentioned this kind of briefly already, President Trump has already tried to do an executive order to mandate price transparency. But the other thing is what, and this is an article, you can actually probably Google this, two fundamental changes without Medicare for all, excuse me. And that is in the state of West Virginia, and we can do this at least for our state employees, and it'll save up to 75%. I don't think it will save 75% in West Virginia. I just think that we have an older population. I'm a realist. I'm a pragmatist. We have an older population and a less healthy population than the state that did this. This was done in Indiana. So Indiana, for their public employees, coupled a high deductible option for their health insurance. And then they funded an HSA equal to that deductible. It was $2,850. And then they had price transparency. And those two things combined saved 75%. The first one, I believe, that saved 35% was the price transparency. But to put that in perspective, in the state of West Virginia, if you're a taxpayer, the last year that I've seen the annual report for the PEIA, the cost was $600 million total in the budget. Can you imagine if we could save a third? They save 75%. But like I said, I grant the fact that I understand the fact that we have an older population, less healthy population, so maybe we won't get those cost savings. But can you imagine if we saved a third or up to 40%? A third would be about $200 million. 40% would be about $250 million. And if we went up to half, 50%, that'd be $300 million. And you ask yourself, well, how did they do that? Well, it's simple. If you know the price and you have a high deductible plan, which is funded by the state, it puts the decision making back into your hands, and you get to price shop. And like I said, you couple that with price transparency, your cost, you're going to be more likely, if you're, for instance, sick, and like, for instance, I got my whole family has been sick in the last week, except for me and my youngest. You will price shop, and if you couple that with actually allowing competition, I'll give you one example. MRIs. I have a friend who happens to be in the House of Delegates now, who has a small business, and we're over here in the Eastern Panhandle, and literally an MRI across the river is $350, but if you go to our local hospital, it's $3,500. Go figure. One last thing, for those who think that that hospitals, nonprofit hospitals, are really nonprofit, I want to remind you, nonprofit is just a tax status. I'm going to read you out 7 years worth of revenue figures from a hospital in West Virginia. Starting in 2011, $650 million, 2012, $689 million, 2013, $768 million, 2014, $741 million, 2015, $777 million, 2016, $968 million, 2017, $1.08 billion. And that's the last figures available. Profits at that hospital, $38 million, $50 million, $50 million, $73 million, $105 million, $56 million, $38 million. That totals almost $500 million, over $400 million in profits in the last 7 years. And it's called a nonprofit. And I will tell you, if you go look into detail about what these hospitals and places spend their money on, you'll be shocked. West Virginia has to change its paradigm, has to move to a free market system with healthcare. It will save all taxpayers a lot of money for both the public employees by putting the patient and the doctor back in the decision-making process. This is the first of many videos to come. Please share this, and appreciate your time this evening. There's a lot more information out here to be shared, but healthcare is something that we need to get a hold on in West Virginia and make West Virginia a free market, more of a free market healthcare system. It'll save the taxpayers, and even if you're if you work for a private employer or you are a private employer, these types of changes can do wonders for our healthcare costs in the state of West Virginia. And if you have any questions, please don't hesitate to reach out to me. Send me a message on Facebook. Call me 304-279-6797. You can email me at mcfolk34@gmail.com. Appreciate your time this evening. You have a great weekend. Be safe, and I'll see you soon. Check me out on folk4wb.com. And if you feel like you agree with some of this stuff, please don't hesitate to drop a donation at that website. Thank you very much. Bye.